Are you looking for lower back pain relief? Do you want a permanent solution? Then this is for you. I'm going to take you through a 15-minute follow-along routine that you can do at home with no equipment. We're going to strengthen the muscles that are weak and stretch the muscles that are tight that cause lower back pain. I've suffered bad lower back pain after I fractured my spine, and I promise you this workout will give you permanent relief. Hi, my name is Yani Burmeister from Unity Gym, where we give you the tools and tips so that you can do more of what you love pain-free. Now, I've suffered a lot of lower back pain. I've got spondylolisthesis and a pars fracture in L4 and L5. Had a military accident a decade ago that really set me back. I fractured my spine and I've suffered a lot of lower back pain. So what I'm going to teach you here absolutely works if you do this, and this is for absolute beginner level, so we're not going to use any equipment. The exercises themselves are very safe and very gentle. It's just a matter of how much weight you lift, or if any weight at all, that makes them challenging or not. So when we're doing these exercises, if it's too easy for you, you can simply grab yourself a dumbbell. I'll show you how to do it when we're doing the workout. And you don't need to warm up for this. The nature of the workout, it warms you up and gets you going. So let's get ready. We'll start in 5 seconds. We're going to start with hip thrust. So we're just going to lay down on our back like this. And the first exercise here, we're going to push through the heels. And we're going to drive our hips up into the air, hold for a second, and back down slowly. Okay. So I'll talk you through why we do each of these exercises and how it all fits into the strategy for lower back pain. Now, this first one is all about strengthening the glutes. Now, when you push up, you get to a posterior pelvic tilt, hold for a second, and then down slowly. And if this is too easy for you and you've got weight at home, you can really easily just grab onto a dumbbell. Whatever weight you've got here, you can put it here. You can have 2 dumbbells, you could have 1 in each hand, and you can really increase the difficulty of this. But we're going to do between 12 and 15 repetitions, okay? So in the earlier phases of dealing with back pain, higher reps and lower weight is going to be really beneficial to you. Now, I've lost count, but I think I've done about 8 reps, okay? So you make this harder by just putting a little bit of weight on your hips there, strengthening the glutes. I'll tell you in a second why this is so valuable for you. But the glutes are just a huge part. I mean, the glutes are the major muscle in the hip joint, the control movement in the hip joint. And when you have weak glutes, it really contributes to lower back pain. So now from here, what we're going to do is a hip flexor stretch. So we're going to come forward, tuck the pelvis under the body and lean into it. So we're basically using active recovery. So the glutes that we were just training there, they're recovering now, okay? And whilst the glutes are recovering, we're doing flexibility exercise on an opposing muscle system, okay? So the hip flexors have nothing to do with hip thrust. They're not, they don't create that movement. So we're letting these muscles that we just used recover, but we're stretching the opposing muscle system. And we do about 30 seconds. 30 seconds is really enough time if you do multiple sets throughout the week to get significant flexibility improvement. And tight hip flexors, weak glutes are a major contributing factor to lower back pain. So we're going to change sides now to about 30 seconds. I've got to make sure I stay on time here. So what we want to do is a posterior pelvic tilt. So we tuck the pelvis under the hips. We don't want the foot back here. We want the foot in front of the knee, and then we're going to lean into it like this. Okay, so that's halfway through this stretch. So, main things you have to consider with lower back pain. Weak glutes, tight hip flexors, weak core, tight lumbar extensors. Those muscle systems, the tightness and the weakness, that's what we're really looking for. This is a really broad strategy, but it works so well. I haven't just fixed my own lower back pain. Let's get down on our backs for some hip thrusts again. Excuse me. Make sure you push through the heels, posterior pelvic tilt at the top. So pull the pelvis back like that. Hold for a second, down slowly. Okay. I haven't just fixed my own lower back pain using this strategy. I've fixed thousands of people around the world. I've been a coach since 1998, And I've used this strategy effectively with so many people. So that's 4 reps, down slowly. Okay, we want to control that eccentric. Hold for a second at the top, down slowly. Okay, this is also going to strengthen the hamstrings as well, which is a part of lower back pain as well. Now, so the strategy remains the same. As you get better, you will increase the difficulty of the workout with more volume, so doing more sets, more exercises on the same muscle group, and also by lifting more weight and doing more challenging exercises like going to a shoulders elevated hip thrust with a barbell on your hips. And I'll do videos like that as well. But most people at the start of their journey, most people are really looking for something that they can do to get them from that point where they're just in so much pain that they can barely get out and just function normally, right? Like we've all experienced this. Well, maybe you haven't, but if you're watching this video and you're this far into it, I can only imagine you have, experienced this life where you have to have painkillers to do anything, and you're in and out of physical therapy where you're going to see, the chiropractor or get a sports massage or whatever it is. Okay, let's get into this hip flexor stretch. So posterior pelvic tilt, bring the foot forward and then lean into it. Keep the rib cage down. We're going to hold for 30 seconds. Okay. And you get on this wagon where you're just having painkillers all the time, and you're stretching because you think stretching's the solution, because stretching does give you temporary relief of back pain. You can do some stretches and you get from this point where you're like in a lot of pain, and you do some stretches and you feel better, but then you're just in pain again the next day, right? That's certainly what my experience has been. And the reason why that is, change sides, is because stretching increases blood flow, blood circulation to the area. And because of the movement, it changes the brain's confirmation of the pain. So the brain interprets the pain differently, and you basically get a relief, an instant relief. So people think that stretching is the solution for lower back pain, but it doesn't provide long-term solutions, does it? It's a short-term fix, unless you're doing what I'm showing you here, where you're strengthening and stretching at the same time. Okay, let's get down. We're going to do another set of hip thrusts. Okay, here we go. And everything that we're doing here is very, very well thought out. So there's a certain amount of volume that you need. So this workout here, just make sure you keep hip thrusting while I'm talking, okay? So we're going up, holding for a second, and then down for 3 seconds, doing 12 to 15 reps. If you can do more than 15 reps, then it's ideal to grab a little bit of weight. Or what you can do, if you can do more than 15 reps, you can actually do single leg hip thrusts. Okay, that's much more challenging. Okay, and that would just mean that you'd do like 8 to 12, but you'd have to do both legs. Okay, so you'd do one leg and then you do the other. So just because I just did a few on one leg, I'll do a few on the other, but I'll get a total of 15. Okay, so there's a certain amount of volume that you want to do on one muscle group for strengthening that is actually going to build strength, build muscle. It's going to give you an adaptation in your body. And as you become stronger in the glutes and stronger in the core, but also create flexibility in the hip flexors and in the lumbar spine, in the extensors, you will relieve the lower back pain, because the glutes and the core are muscles that are majorly responsible for the way that it holds your posture, that you move. The glutes are a massive part of walking around, moving, standing up, same with the core muscles. And when they're underactive, when they're not doing their job properly, your pelvis doesn't sit properly, and it puts a lot of pressure on the lower back. Now, to top that off, all the sitting down in a chair that we do all the time, it puts the hips into this flexed position, which creates a lot of tightness in the hip flexors. And then through this, what that does is that creates an anterior pelvic tilt when you're standing up and you've got really tight hip flexors. That puts pressure on the lumbar extensors. It puts you back into extension. And all of this, it all just adds up into lower back pain, a lot of problem. So we want to be creating flexibility in the hip flexors, strength in the glutes, flexibility in the lumbar extensors, and strength in the core. And that's what we're doing in this whole workout, okay? So this is our last set of the hip thrusts and the hip flexor stretch. And now we're going to move into some core exercise and some lumbar flexion. So we're going to be stretching out the lumbar extensors, okay? So for the core exercise, we're going to be doing a bent knee, hollow body hold, and I'll show you how to progress it if it's too easy for you. So from here, you're going to start on the ground. We're going to get into that posterior pelvic tilt, push the lower back into the ground, lift the shoulders up, okay? And then lift the feet up, and we're going to hold for between 15 and 40 seconds. Now, if this is too easy for you, you do a rock, but the only way that this is a viable option is if you can rock smoothly like what I'm doing. If you're doing this, like that, that's not for you. What we really want is the shoulders up, lower back pushed firmly in the ground, feet just off the ground, shoulders relaxed, head relaxed. We don't want to be shrugging the shoulders like this. If you can fit your fingers underneath your lower back, then you should stop, and that's as long as you do it for, okay? As soon as your lower back starts to come off the ground, you stop, and we really want to feel it here, okay? Now, what we're going to do, this next one, we're basically just going to do a squat. So come down into a squat, but I understand that for a lot of people, you're not going to be able to squat like I can. I totally respect that, so I'm going to show you how you can progress that, regress that, I should say. Now, I've got a couple of weights here, but you can just use a broomstick. Like if you had a broomstick and you stood on the broomstick, that really allows for a lack of flexibility. You might be like this, that's totally fine. But just by sitting down into this squat position, this is really going to help relieve lower back pain. But what we're going to actually try to do from here is to lean forward as best as we can and then come back up. And then again, lean forward as best as you can. Come back up. And again, and now just hold it for 10 seconds. So we're trying to round our lower back out as much as we can. Okay, you wouldn't believe how much better I am at this than when I started. My lumbar extensors were so tight when I started doing this kind of training that I couldn't come close to this. I would have barely been able to get to there, and that was only a few years ago. Okay, all right, let's get down. We're going to do round 2 of this core exercise, the hollow body hold, bent knee, hollow body hold. So from here, tuck your chin to your chest, shoulders up, lower back pushed firmly into the ground, lift your feet off the ground. We'll be feeling it in the core straight away. Okay, and we're just holding. If it's too easy for you, and if you can actually manage a smooth rocking motion notice that my knees aren't swinging back towards my shoulders, okay? It's very challenging. It looks easy, but it's much harder than it looks. So we want to try to get, I'm already feeling that in my core, really starting to get in there now. So 15 to 40 seconds is a really good time to hold that. Now, okay, come down into your squat position here. So the squat, because it compresses everything up, it helps to take pressure off the lower back. So you can, it's quite common that you'll feel a really good stretch in your lower back here, or you'll feel a sensation down here. That's usually a good feeling, right? It's a feeling of that your lower back is being stretched out. 1. So the reason I've made this a 15-minute routine is that one of the things that people really struggle with in today's day and age is just finding the time to do this. And it's really important for me to show you that this kind of thing can be done in 15 minutes, in as little as 15 minutes a day. If you did this routine, you'd probably start, if you had bad symptoms, every second day. You know, you'd do a routine like this every second day to give yourself a little bit of a time to recover, and you see how you feel. And if you felt worse the next day, then just do less volume the next time you do it. Just do 2 rounds of these exercises instead of 3. Okay, jump down on your lower back. We'll do the 3rd and final round. Okay. And then if you can handle 3 times a week, so every second day, you could increase it to every day. But the truth is, like in all honesty, if you are going to commit to that level of exercise, there's better things you could be doing on those other days. Doing this 3 days a week, if you were honestly committed and you did this for 15 minutes a day, 3 days a week, I guarantee you within 2 weeks, you'll be feeling a significant reduction in lower back pain. And within a month, it'll almost be gone. And of course, everybody has different symptoms, different conditions, right? I'm not saying this is a one, like there are going to be people who their condition is much worse than the average person. And I respect that for those people, you may need more than this. But I've had people come into Unity Gym that had bulging discs, herniated discs. They were in such a bad way and they were so afraid of doing any kind of exercise. And we got them doing a version of this workout, but they were even lifting weights. And they were so afraid at the start and were just progressive. And within a couple of months, they were lifting more than their own body weight in a deadlift. You know, their back pain was completely gone. It was a thing of the past. So I promise you that this strategy works. And if you look what we've done, we're just coming up to the 15-minute mark now. So just try and sit in this squat position for as long as you can to the end of the workout. You know, with only 4 exercises, with 2 strengthening exercises, one for the glutes, one for the core, and 2 flexibility exercises, one for the hip flexors, one for the lumbar spine. But you know, this squat position is for a lot more than the lumbar spine, but that's what we're doing it for. With just that and getting enough volume, you'll see a significant reduction in lower back pain, I promise you. And of course, there's progressions from this. I've got some great videos where I take this to the next level and we start introducing some weights. And if that's something that you're interested in, then check it out. Just click the link there or tap the screen. Jump on in and check that video out. If you got value out of this, please like the video and subscribe to the channel. And I'll see you in the next video.